I'm Dr. Saumu Mueni. I am a pediatrician, a pediatric endocrinologist, and diabetologist, currently working at Chuka Level 5 Hospital in Tharaka-Nithi County. I am also the Secretary for Pediatric Endocrine Society of Kenya. I finished this degree in the year 2016, after which I was posted to Chuka County Referral Hospital as a pediatrician. So at the point I was posted here, I remember this hospital had stayed for several years without a pediatrician. And the pediatric department was not very busy. I remember I would see about 5 to 10 patients in a day, and in the clinic we would see around 5 patients. So when I was posted here, I found a pediatric department that was not very vibrant, because the hospital had stayed for several years without having a resident pediatrician, and I was tasked with the responsibility to make the department work. I have recently completed my fellowship in pediatrics and adolescent endocrinology, and I am the newest entrant in the field, and I would say also the youngest. And in Kenya, most of the pediatric endocrinologists are based in the main towns, specifically Nairobi city and its environs. And I am so happy that I am among the very few pediatric endocrinologists who are currently working in the rural setting in the counties. And the reason why I decided to come back to the county and serve the community here is because we have many children and adolescents with endocrine disorders and diabetes, and they too deserve to have access to specialist services. So as a pediatric endocrinologist who is very passionate about changing and improving the care for children with type 1 diabetes, we have liaised with my colleagues who are in the Pediatric Endocrine Society of Kenya, and we've been able to come up with training curriculum for the country, targeting mainly pediatricians, medical officers, clinicians, and all the other cadres. And this program has really impacted positively on the outcome of these children with type 1 diabetes. The other program that we are doing, and this is a program that we've started in Chuka Hospital, is the school program, whereby we are mapping out children with type 1 diabetes and tracing the schools where they study, and going further to do trainings for the teachers and the school community, so that we ensure that these children can have the best care, whether they are in school or they are out of school. It was the fact that I would see children with these endocrine disorders and most of the time I had to refer them to Nairobi, Kenyatta National Hospital. And I managed to complete this training in December 2023 and came back to the county. What is pediatric endocrinology? Pediatric endocrinology is a subspecialty in pediatrics that deals with children who have hormonal disorders, such as thyroid disorders, adrenal disorders, growth, and we also deal with children with obesity, children with type 1 and type 2 diabetes mellitus. So one of the main reasons I decided to come back to the counties and work in the rural setup was because I am very passionate about community service, and especially in the rural setting where we have many children and adolescents who are not able to afford highly specialized services. And as a pediatric endocrinologist, what I am doing on ground currently is, one, I have been able to set up a pediatric and adolescent endocrinology clinic with Chuka County Referral Hospital, and we usually run our clinic every Wednesdays. And in this clinic, we are not serving patients from Tharaka Nithi County only. I am also serving children from the adjacent counties such as Embu County, Meru County, Kirinyaga County, etc. We have also set up support groups for parents with children with type 1 diabetes mellitus. And in these forums, parents are able to share ideas on how they are managing their children and get encouragement from each other. Yes, growing up in the village in Kitui, access to healthcare was a challenge. And I would see relatives lose their children, and looking back, I think those deaths could have been prevented if only these children could have had access to a specialist, specifically a pediatrician. And this really inspired me to make the decision to become a pediatrician. I feel so humbled. I feel so honored and privileged to be among ladies who have been nominated to get this prestigious award. And to me, this is kind of some affirmation that whatever I am doing currently as I serve the community is something good, and I should continue doing what I am doing. So I am really, really privileged.